And now just to, shake our shoulders a little bit and take you through to a beautiful island of Mauritius. And I will just introduce Dr. Sheila Bunwaree, who is joining us. I think even as I give her intro, just to see if she's with us in the room, but I think she is. She was a professor of sociology and development studies at the University of Mauritius since 1993, and she worked as a gender and social development consultant for a number of regional and international organizations. She has also been a fellow at the African Institute of South Africa, as well as a visiting fellow at the Australian National University in Canberra, and her research interests have gender and development, education, globalization, and governance. So we are looking forward to be spiced up with more information from Dr. Sheila Bunwaree, who is joining us from Mauritius. Dr. Sheila.
Hi everyone, and thank you to the organizers for putting this very pertinent conference, sharing of experiences. Well,
Dr. Sheila, I'm sorry, do you mind to increase the volume on your microphone or to be a bit closer to it?
Okay, I'll certainly do that. Can you hear me now? No? Can you hear me? Can you hear me?
We can hear you, it's better.
Yes, thank you. Yes, let me start off by just saying how I personally think that context, we've heard about these different places, context is extremely important in thinking about the impact of COVID-19. And certainly Mauritius being an island state, as Professor Renu Murthy mentioned in her introductory remarks, it's very atypical from the countries on the continent. The very fact that we don't have borders with other countries, we're surrounded by the sea. We don't have the inflow and outflow of migrant workers coming in, although we do have a pool of foreign workers coming in for different kinds of...
Madam, the camera angle is not proper. Can you down it, the mobile, so that we can see you properly? Camera is not, the camera angle is not proper. Just a little bit down if you can give.
Can you?
Yes, perfect.
Okay, right. Thank you. But I can't see anything now. The puppet is okay, let me just carry on. Anyway, yes, I was saying that context is very important. And as some of you who would have been following the different evolutions in the different countries, Mauritius is rated as having scored very high on its very stringent measures that it has adopted. A group of researchers sitting up in Oxford have actually declared that Mauritius is one of the countries with a very high score of a stringent index, because it was very, very quick in responding to the announcement that Wuhan in China has been having all these cases. So we started sort of having tests of people coming in right in January at the airport, because as many of you would know, Mauritius is an island which is very dependent on the tourism sector. I evoked this early on in my introductory remarks because as Dr. Pilani was talking about the informal sector, it's very important for us to realize that Mauritius is a country with hardly any resources apart from tourism and the offshore sector, which are the two main sectors of the economy. From a medical point of view, I think there is no contestation that Mauritius have done fairly well, relatively well, because of the stringent measures adopted at a very early stage in terms of lockdown, closing down its frontiers, a sanitary curfew was introduced, and therefore people were confined for more than 10 weeks at home. No schools, no office, no work, but no work meant a number of livelihoods gone, particularly in the informal sector. Now, when I talk about the informal sector, it's very important for us to realize that the informal sector in Mauritius is not well documented. There is not much official data. Even the Ministry of Finance argues that it does not know exactly how many informal sector workers we have. And yet we are a very small country. And of course, the gender dimensions of this informal sector and the loss of livelihoods will also be discussed perhaps in question time. So we've had 10 deaths in a small country like Mauritius, 10 cases of COVID, 10 people who died, and that's very sad, obviously. But at the same time, we are having people in government who are very full of praise of what has been achieved because we've controlled the disease in a fairly effective manner. And this is also due to the fact that we've had early contact tracing, very good testing. And one important element that perhaps we should bring up here is also because we've had support from China and India, the two countries from which our people actually come, including from Madagascar and Africa, because as many of you would know, we do not have an indigenous population. We are a nation of migrants ourselves, a nation of migrants in the sense that we all come from different parts of the world. And the economic and the diplomatic ties that we have with China and India have been very important in terms of allowing us to sort of have special flights, despite the fact that frontiers were closed, to bring in medication and equipment that we were lacking in the very early stages of the breakout of the pandemic. And that helped us enormously. That helped us enormously. That said, when we look at the different, and this is where I agree with Dr. Filani completely, I think when thinking about the impact of the pandemic of COVID-19 in a place like Mauritius, it's more on the livelihoods of people and what is happening now and what is likely to happen in the future, in the years to come. We are also a country which is highly dependent. 80% of our imports of food, or 80% of our food requirements come from imports. So you can imagine that one of the very first implications of the COVID-19 was that there was panic buying and some kind of a feeling that food was going to be in short supply because of the supply chain not coming in. But somehow we managed to get food available, but the fear and the anxiety and the evidence that has been put to bear about the importance of being self-sufficient in food, at least partially self-sufficient, has come up in a big way. And now we are hearing that one of the implications of seeing the evidence in front of us is that we're going to try and develop and diversify the agricultural sector, which had been in terrible decline since independence. So on the implications of COVID, it is the livelihoods and the economy which is at stake. Medically speaking, we've done quite well. We've been able to control the disease. We are cited as a success story by many other governments and many other places. But at the same time, we are fearing a second wave. Why are we fearing a second wave? It's because we are thinking of reopening up the tourism industry because it is our main sector of export earnings. And as it is our main sector of export earnings, and as we juggle with how to open, what sort of sanitary measures are we going to put into place, it's becoming increasingly difficult to think of how we're going to do that. And yet we have no choice than open up. So we are going to open up. But as we are opening up already to bring in our own foreign workers who are working abroad, and there are a few who are stranded, and there have been news of how we've delayed the process of bringing, for example, we have good numbers of Mauritian workers working on cruise ships who are stranded everywhere in different parts of the world and who've not been able to be brought back to Mauritius. We don't know the real reasons as to why, but every time we hear the Ministry of Foreign Affairs telling us how difficult it is. And slowly and surely we've begun to bring them back. But as we begin to bring them back, we've had a few, although seeming very negligent, we are having a resurgence of a few cases of COVID coming up again. So there is fear and anxiety within society that as we open up our doors and open up frontiers, we're going to bring back COVID into the country. And that's something that we're still wrestling with, but there are no two ways. The decision has been made that we're going to open up the tourism industry. Whether we're going to be able to rebuild, because it's probably the most fragile sector of the economy, whether we're going to be able to rebuild the tourism sector and make it be the one sort of force that we had is still under interrogation. We still ask a big question. We don't know. I don't think there is anyone who's got an answer to that particular problem yet. That said, I think it is also important to realize that in a country like Mauritius, we have also the foreign workers. And here, foreign workers come in for the construction industry, because, for example, we had a big sort of development of the metro industry, of the metro, of trams in Mauritius, and we had to import foreign workers. Now, at the very outset of the outbreak, we've had situations where these foreign workers were having great difficulties in getting food supplies into their dormitories, but that was addressed very quickly. And then it was hush hush. We don't hear anything about it. We hear there are foreign workers there, but we don't have any particular cases of COVID. And that was very good. So from the tourism industry, from the agricultural sector, when we look at measures, because we'll probably pick up on some of these issues again during the question time. But when we look at the measures that have been adopted by the government, I think that has helped immensely because we've had online teaching when schools were closed, and that was very effective. But the digital divide...
Ms. Sheila, I'll just ask you to wrap up in the next...
I'll do that. I'll quickly talk on the measures because there are two very key measures that were adopted apart from the medical side and what was done. In terms of support to the people and workers, we had two major instruments. We had a wage subsidy, a wage support scheme given to all workers, and another self-employed wage support given to informal sector workers. Although the data was not sufficiently disaggregated and we don't know enough about the informal sector workers. So looking forward, I think there will be a need, like Philani was saying, in Mauritius too, I think there will be a need to look at how to formalize the informal sector workers and with gender perspectives, because many women reported not having been able to access the support that was there. And therefore, the new faces of poverty are beginning to arise in a place like Mauritius, and new forms of inequality are made in the open, are made to bear in the open now. We've seen the housing crisis coming up in a very strong way as well. And I think the signs are worrying, particularly from the economic side and what is going to happen for a country which has changed legislations. And just one last point that I want to make, all this is happening in a very dire political situation because the government has just sacked the #2 vice prime minister whose name has been quoted in a major corruption case. And there are investigations on. And also the other major worry is that the name of the Minister of Health himself, who has been praised for very good work during the COVID time, has been cited again and again as being involved in some kind of scandal. This is alleged scandal. We don't know whether it's true, but sooner or later we'll find that there are things unfolding in this particular sector, and the country certainly doesn't need all these scandals and corruption and with lots and lots of money being wasted instead of addressing the problems of the poor and the downtrodden. Thank you.
Thank you very much, Dr. Sheila, for those insights from the side of Mauritius. I'm sure that there are quite a number of questions that are coming up now.